For decades, a diagnosis of feline infectious peritonitis, FIP, was the single most traumatizing event in feline medicine, a clinical death sentence that left veterinarians and owners with little choice but palliative care or euthanasia. But as of 2026, we are operating in a new reality. FIP is now defined as a treatable, and maybe even curable, condition. To effectively manage FIP today, we must unlearn the myth of its 100% fatality and adopt a precision medicine mindset. This shift begins with challenging the very foundation of how we believe the disease develops and spreads. The 2026 UC Davis research has added critical nuance to the traditional internal mutation theory. While spontaneous mutation remains a factor, advanced sequencing has revealed that it is far more complex than a single genetic event. We now have evidence that virulent FIP-capable strains can circulate between cats in shared environments. Cats aren't always just unlucky. In multi-cat settings, they may be directly exposed to viral strains that are already genetically primed to cause disease. Research has identified multiple genetic switches rather than one single mutation. Coronavirus is remarkably hardy, surviving in optimal conditions for up to 7 weeks. We now understand that the environmental viral load is a primary driver of risk. This updated understanding of viral dynamics is the foundation for our 2026 clinical protocols, shifting our focus from passive observation to aggressive drug-led intervention. The transition of GS441524 from the unregulated black market to a licensed pharmaceutical reality is the most significant breakthrough in modern feline internal medicine. As of 2026, GS441524-based medications are fully licensed in the UK, Australia, and the EU. In the United States, practitioners are operating under the FDA's Guidance for Industry, GFI, number 256, which allows for regulatory discretion in compounding these life-saving substances from bulk drug sources. Regulated protocols have yielded unprecedented remission rates, with up to 90% remission seen in wet cats, and a staggering 50 to 65% for the previously untreatable neurological form. Perhaps the most significant change for the modern practitioner is the shift in duration. While the 84-day protocol remains a baseline, new evidence from the FVE and ABCD supports a shortened 42-day course for many patients. This halving of the treatment window addresses the primary barriers to success: financial burden and client compliance fatigue. However, a liaison-level tip for your practice. The 2026 Masti et al. Research confirms that injectable formulations yield significantly higher serum concentrations than oral formulations. For cats that are severely ill, dehydrated, or failing to meet milestones, the injectable route remains the gold standard for stabilizing concentrations. Success in 2026 depends on moving beyond one-size-fits-all to proactive precision dosing. We now use a dual-layer approach to offer cats a personalized treatment strategy using serum amyloid A as a marker of inflammatory status and measuring exact serum levels of GS441524 to check levels are maintained above the therapeutic minimum. The final component of the 2026 protocol is empowering the owner to manage the feline environment and monitor recovery at home. The 5-cat rule. Data consistently shows that keeping cat group sizes to 5 or fewer significantly lowers the environmental viral load and reduces the stress that triggers FIP development. Litter hygiene. In multi-cat households, the 1 box per cat plus 1 rule is mandatory. Feline coronavirus is primarily shed in feces. Twice daily scooping and monthly disinfection with dilute bleach are critical to interrupting the horizontal transmission cycle. The FIP paradigm has officially shifted. We are no longer managing a terminal illness. We are managing a complex, infectious disease with a high probability of cure.